Welcome to the Plant Trainers Podcast, where we're helping people improve their quality of life through nutrition and fitness. And now, your hosts, nutrition and wellness coaches, international speakers, Adam and Shoshana Chaim.
Hey, I'm Adam Chaim.
And I'm Shoshana Chaim, and we are Propelled by Plants.
Today we bring to you episode 403, What's Missing from Medicine, with Dr. Saray Stancic.
In this episode of the Plant Trainers Podcast, we talk with Dr. Saray Stancic about her documentary, Code Blue, her book, What's Missing from Medicine, and of course, her personal journey with health and a plant-based diet. Her own journey with MS, feeling perfectly fine one day and waking up from a short hospital nap, not being able to feel her legs, is simply amazing. You're going to be at the edge of your seat listening to her speak today.
Dr. Stancic is triple board certified in internal medicine, infectious diseases, and lifestyle medicine. In 2012, she left her work in infectious diseases to fully dedicate her time to the field of lifestyle medicine. Her interest in lifestyle medicine is rooted in her personal story as a patient living with multiple sclerosis. She's the founder of one of the first lifestyle medicine practices in the country and mentors the Lifestyle Medicine Interest Group at Rutgers, New Jersey Medical School. She's the producer of the documentary film Code Blue, which made its global release on May 26, 2020. Dr. Stancic released her first book on January 12, 2021, entitled What's Missing from Medicine? 6 Lifestyle Changes to Overcome Chronic Illness. This is such a great episode. Please share it out, and we hope you enjoy it.
Exciting news, everyone. My new book, I Am a Peaceful Goldfish, is on pre-order now. It's perfect for any child ages 0 to 7. Stock up on your birthday presents, on your baby shower gifts today because it is available on Amazon. Just click the link in the show notes at planttrainers.com.
And now for a moment of gratitude.
I am super grateful because I have an endorsement from Dr. Dean Ornish for my book, I Am a Peaceful Goldfish. When he sent me the little blurb, I was just so thrilled and grateful that he even took the time to read it.
I'm so proud of you and grateful for the fact that you've put this book out there and it's going to help so many people and their kids.
Dr. Saray Stancic, thank you so much for joining us on the Plant Trainers Podcast today.
Thank you so much for inviting me. It's a great pleasure to be with both of you.
It's a great pleasure to be with you as well. We've been waiting for this for a very long time, and we would love to know if you have a moment of gratitude to share with us and the listeners.
Well, I want to offer gratitude to my very loving and supportive family. I'm very fortunate to have an amazing husband and children that have carried me through some difficult times, and I'm grateful to them. I also am grateful in recent news that this COVID-19 pandemic, we're seeing some movement in a positive direction. I think yesterday the Wall Street Journal said there was a 77% reduction in new cases. So that is a blessing and certainly something for us to offer gratitude today.
Definitely. And we are recording this a couple of weeks earlier. So we're about we're the end of February now. It's a short month, but hopefully by the time this gets to listeners' ears, that stat will be increased even more, or at least consistent.
Yes, even better.
So why don't you bring us back a little bit and let us know how you found a plant-based lifestyle and what you experienced when you decided to embrace it?
Yeah, so I'm an infectious diseases specialist internist. And so how is it that I became this passionate advocate of plant-based nutrition and lifestyle medicine? Well, it largely stems from a diagnosis in 1995 as a young medical resident. In the midst of a very busy on-call in the hospital, I awakened to find that I couldn't feel my legs, and that acutely. It's interesting because just an hour before I was running around the hospital. I took a nap, I woke up and couldn't feel my legs. I ended up in the emergency room with a diagnosis of multiple sclerosis, and that really put me on a path. As a chronic disease patient, really struggling and suffering through this diagnosis, ultimately leading to a point in my life about 8 years into the disease that I was dependent on 12 medicines and I was walking with a cane and really, really struggling. And then by chance, I came across a publication that discussed the connection between multiple sclerosis and diet. And I was struck by this because here I was, a dual board certified attending physician, and I knew nothing about nutrition, which is remarkable. And so this was the catalyst that really drove this interest in wanting to understand these connections. And I just delved into the literature and just consumed anything that was related to these connections. And that really extended into not just diet, but lifestyle, exercise, stress, sleep, all of these variables that were yet so incredibly important, yet had not been discussed or covered during all my training. 10 years of my life, it was 4 years of medical school, 4 years of residency, and then another 2 years as a fellow rather. And I had never learned these connections. So to me, it was an exciting period. And as I learned more and more, and it was a journey of empowerment. And as I started to introduce these behavior modifications into my own life, I started to reap extraordinary benefit. And I started to feel better. And I was able to taper off of every one of those medicines and ultimately crossed the finish line at a marathon. And that was a very special day for me, Shoshana, because it wasn't just that I had run a marathon, but it was that all the changes that I had implemented in my life had borne fruit. And I realized the power that lies in lifestyle and how important this therapeutic intervention, this tool I had in my toolbox that was really quiescent, because as a physician, it wasn't part of the armamentarium that we were trained in. So I realized then that it was, of course, very special that it had changed the course of my life, but I needed to now share this. And so in 2003, as an infectious disease physician, and then introducing the changes into my life, by 2011, I decided that I needed to leave behind infectious diseases, a field that I had been practicing in for 16, 17 years, because I felt compelled to do what I could personally to disseminate this all-important message. And so that's what's led to the film Code Blue and the book What's Missing from Medicine. And you can understand why I chose that title. And my clinical practice and all the work that I've done over the past decade has really been in an effort to disseminate this all-important message, because I think we can save so many lives and improve the quality of life of Americans across the country and beyond. And this is really a global effort.
We talk about the power of food so often on this podcast, and we talk to people that have transformations and life-changing moments. And I'm curious to know, others with multiple sclerosis, is that pretty typical that if they change their nutrition, their results will change for the better? Does that happen with most of them?
Well, there's a spectrum in multiple sclerosis. It depends when you introduce the change, how much damage has been done. But here's the thing. This idea of lifestyle medicine and plant-based nutrition is going to serve all of us, regardless of where we are. I would not say that, because we don't have the clinical studies yet to speak to this conclusively, but I can tell you that I have seen a lot of patients with multiple sclerosis, and we've talked about introducing lifestyle modification, and anecdotally, I've seen so many flourish. But in science, we have to conduct clinical studies in order for us to speak conclusively. But I would say that I have patients who come to see me because they're newly diagnosed multiple sclerosis. And often this is a disease that we see in women and in young women. It's typically diagnosed early in life. And so I might see a 30-year-old or a 40-year-old with newly diagnosed MS. But the thing is that some of them come in and they're also obese, they're also hypertensive, they're also hypercholesterolemic. And so the wonderful thing about this prescription is that when we address lifestyle, we're not only improving outcomes in MS, but we're also improving outcomes in all those other chronic diseases that I just listed. And also we're reducing risk of breast cancer, we're reducing risk of Alzheimer's disease. So this is the beauty of this approach. It serves to raise that veil of fatigue that is so common in MS. It offers us a solution to the anxiety and depression that we often live with. So I think that's what's most exciting about lifestyle medicine and why it's so exhilarating to share the message, because it's infectious, it's contagious. And the wonderful other piece is that when we feel better, everyone around us is attracted to that and they want to learn more about what you're doing. And I often have patients who I see the daughter, the mother, and the grandmother, because they all want to learn. And then we have family units that change. And that's really what this is. It's about continuing, and thank you for the work that you do with your podcast and serving to raise this issue of awareness. Because every time someone signs on to your podcast and learns about plant-based nutrition and learns about optimal lifestyle, that's yet another person that we've avoided that terrible journey, that path that we see so commonly in our country. As a physician, putting aside my chronic disease hat as an MS patient, I've been practicing medicine for 27 years, and in that capacity, I have seen so much pain and suffering that I know is largely preventable. So many days going to the nursing home at the end of my day and doing consults on patients with dementia and status post-stroke or status post-heart attack, and knowing that we could have prevented this. And it is a missed opportunity. It has been a missed opportunity. I think the good news is that so many physicians now are evolving and gaining this awareness. The American College of Lifestyle Medicine is growing near exponentially. More and more doctors are learning about this, and we are fighting to create a shift in paradigm. We want all doctors to learn this when they're training in medical school. So part of my passion and my commitment to this change is to create an interest in modifying the curricula in medical schools and health professional schools so that all individuals who are practicing in the healthcare setting are able to understand the power that lies in lifestyle. Because it's not just about changing individuals, but it's assuring that the healthcare system changes as well and speaks to this.
Absolutely. And I think that's part of, you talked about having the podcast and you talked about doctors' perspectives and all of that. And when Adam was diagnosed with his tumor 11 years ago already, he found a plant-based lifestyle on his own. And it was devastating for us. I was pregnant with my daughter. They told me to get prepared because anything could happen at any moment and I might need to raise my kids on my own. And he went ahead and he did that on his own. And within a year, we saw that tumor shrink. We saw his heart disease go away. And he wasn't obese. We were athletic. He wasn't obese. But both doctors turned and looked at us and said, oh, well, it can't be your diet. There must have been some other kind of something out there. You were in Mexico smoking something, or you did a trial study in the States, right? They weren't accepting of it. And that's when we decided that we needed to create the podcast to prevent as many people as possible going through the devastation that we were going through. It affected us. It still affects us because of mental health, right? PTSD, all of that. And we just wanted to help as many people as possible get the information, not ever go down that road. And if they were already down that road, which a lot of people were, give them the tools to come out. But it didn't matter if it was a tumor or heart disease or MS. We were covering all bases, the foundation of all bases, all at the same time. And I really do hope that today that same doctor has a better understanding of plant-based nutrition and accepts it and recognizes it and is hopefully recommending it.
I hope so. And by no fault of his or her own. And I talk about this in Code Blue. I blame the medical schools who have been negligent in speaking to, there's ample evidence in the literature, in peer-reviewed medical literature, that speaks to the importance of nutrition and its effect on disease genesis. And they have not effectively conveyed that message. I think there's a lot of interest in creating change. There are medical schools that are doing that already. If you saw Code Blue, we featured a medical school in the film that is built on the principles of lifestyle medicine, which is an amazing accomplishment. And it should be the way we move forward in regards to, it should be the playbook, right, for future medical schools, and other medical schools should mimic what they've done because they've been so successful. I had the wonderful opportunity of visiting the schools on several occasions and speaking to medical students that are in attendance. And it is such a different experience from what I had, in that everything that they do is embedded in the principle. They have culinary medicine. They create an environment where they include advice on physical activity every day for the students themselves. They start their day with a little bit of meditation in the lecture hall. So everything that they're creating in that setting is speaking to health. When we go to medical school, and the way medical school curricula are built is on this idea of pathogenesis, we learn the disease state. We become really good disease detectives We take thorough histories and physicals, and we draw labs, and we do imaging studies, ultimately to make a diagnosis. And then once we have the diagnosis, we treat with a pharmaceutical agent, a procedure, or a surgical intervention. That's pathogenesis. But the mirror image of that is salutogenesis, which is the study of health and wellness. And we don't learn anything about that. It's like half of the human health continuum is completely ignored in medical school.
Is there any transition, though? Sorry to interrupt. Is there any transition in the medical schools to move away from the pathogenics and look into the underlying cause of all these issues so that they could actually treat what the problem is rather than just medicate and deal with the symptoms?
Yes, that's the trend right now. That's what's so incredibly exciting, is that there are medical schools, there are leaders, there are deans that are running these medical schools that see that there's a gap and there's a lapse. We're doing a lot of great things in medicine. I mean, think about all the advances, even in the COVID-19 pandemic, the fact that we have how many vaccines now in less than a year, that's amazing that we have the technology and expertise and to create solutions. But think about it, 1 in every 2 of us in this country is living with at least one chronic disease. 70% of us are obese or overweight. If you're normal weight in the United States, you're in a minority. The CDC tells us that by 2050, 30% of us will be living with diabetes. That's crazy. It's unsustainable, but that's the path that we're on. And the solution to the problem is not developing yet another drug to treat diabetes or yet another drug to treat hypercholesterolemia. The solution is really quite simple. It really is, but nobody wants to believe that the solution could be so simple. It is. It's really this simple. We need to eat primarily plants. We need to move every day. We can't sit and just watch one television show after another on Netflix, which is what many of us are doing now in the midst of this pandemic. We're sitting on the couch. We have to get up and we have to move. We have to find a reason to get up and move. We have to change our perspective, how we interpret stress in our life. We need to learn how to sleep properly. So many people are addicted to hypnotics like Ambien or whatever, using alcohol or some agent to sleep, and that's not effective sleep. And alcohol and drug abuse, and these are all issues that are important and they need to be addressed. But when we optimize all of these aspects, we know we can prevent 80% of disease, and we know we can live life to the fullest, free of chronic disease. We have the capacity to do that. I say this in my book, and I say it all the time, but it's true. My hope is that each and every one of us at age 95, 102, whatever that last day on planet Earth, that you spend it surrounded by your family, friends, lovingly, and then that night you go to bed and you pass away peacefully. Not what we see today, where people suffer in a nursing home for the last 6 months to 2 years or whatever. We can avoid that. We can avoid that. And the solution is this very simple plant-based lifestyle, and it's incredibly powerful.
Definitely, and so much good information there. And I almost want to tell everybody to rewind and listen to that again, or send that to their doctors, send that to people they know. And so in terms of Code Blue that came out May 2020, it was actually really interesting. I'm sure you didn't plan it that way for it to launch at that time, but it was a good time to launch when people were kind of paying a little bit closer attention. What was the message that you really, really wanted people to hear?
It was a message of empowerment, right? That we can all do this. And certainly the film tells my story, and it also tells the story of some of my patients. And I think, again, the point is that we can all implement these changes in our lives, and they can be incredibly powerful. But beyond that, I wanted to tell the story of the lapse in medical education and the lapse in the way physicians practice medicine. How this is completely ignored.
Sorry for the interruption. Wanted to say that as children, we didn't necessarily have all the tools we have today to approach challenging moments, and we weren't really as grounded as we can be today. But imagine if we had learned some of those skills as children, how good we would be at approaching those situations now. Today's stress is at an all-time high. Children need to feel safe and calm. My new picture book, I Am a Peaceful Goldfish, teaches mindfulness and playful breathing techniques to kids and and their families so that they can feel a little bit less overwhelmed. Through fun imagination and inspiration from objects found around the house, they go through a series of short breathing activities to help them feel calm and grounded. I'm a Peaceful Goldfish is available for pre-order everywhere books are sold online. Visit Amazon today and help us become a top-selling book. And now back to the show.
That the solution to every problem is always developing yet another drug to treat that problem. But we're not drilling down and addressing the root causes, right? So when I was diagnosed with multiple sclerosis as a young woman, certainly the fact that I was a medical resident, not sleeping very much, working 24, 36-hour shifts, I was highly stressed. I was eating primarily out of a vending machine because what's open at 3 o'clock in the morning when you're in the hospital, right? It was the perfect storm to create and feed my genetic predisposition. So I developed multiple sclerosis. And so I think that there's been this misunderstanding, Shoshana, for many, many years, decades, even in medical school, that we are defined by our genes, that we have a genetic predisposition and there's nothing we can do about it, that we're definitely going to develop diabetes, or we're definitely going to develop breast cancer, or we're definitely going to develop multiple sclerosis, that this is encoded in our genetic makeup and we can do nothing about it. And that's not true, right? There's this science called epigenetics that tells us that gene expression is dependent on outside variables. That is, just because you have a gene that predisposes you to diabetes doesn't necessarily mean that that gene will be turned on, right? So genes are like a light switch. We can turn them on or off. And epigenetics tells us that there are certain variables that are really important in regards to what genes get turned on or off. And it's things like diet, exercise, stress, sleep, alcohol, smoking, lifestyle medicine, right? So the beautiful thing here is that the film is telling you essentially that you're in control. We're putting the reins back in your hands, that you can do this. Now, you can choose to or not, but it's available to all of us. The missing piece is that our doctors are not talking about this. So if a patient is going to their internist or their endocrinologist and the cardiologist, and they're not even offering this as a possibility, as an option, then it falls on deaf ears and it creates no change. I think the good news, again, is that the world is changing. There's a palpable shift in the field of medicine. More and more physicians are becoming aware and are creating change in their practice. And the good news is that medical schools are catching on, and they're introducing this into the curricula. And so we're seeing a new breed of young physicians. So many of my medical students are amazing and eager to get out there and redefine the healthcare experience. And that's really where my focus is right now, is redefining, reimagining what the healthcare experience should be, so that we can create happy and healthy patients that live to their potential. Imagine if we all felt well, if we all got up in the morning and felt energized, symptom-free, medication-free. Imagine the potential each and every one of us could achieve. I think that's mind-boggling.
Are you getting any pushback from the medical community at all? I'm thinking like the older doctors are probably not ones that want to redo all their education and they want to now change what they're doing. And so there must be some pushback.
There is pushback, but I'm seeing less and less of it. And you know what? Pushback is healthy, because this is true, there are people out there that are peddling bad science, right? So as a physician and a scientist, it's really important to have a little bit of, to be skeptical and assure that what you're speaking of is scientifically and sound. So I think that, yes, there's been pushback, but the evidence is so much so that you can't ignore it anymore. It's become mainstream. Like the American Association of Clinical Endocrinologists, their most recent practice guidelines for diabetes, I believe it were updated in December of 2020. Now for diet, it recommends a plant-based diet. And in the American Association of Clinical Endocrinologists, which is amazing, because you can't ignore it anymore. The studies are there and the data is incontrovertible. And so I think as the data and the science flourishes, it's going to bring more into the fold. But yes, of course, there are those people, as there are everywhere, that will resist until they die. And that's okay. they're going to miss out on the good benefits of this party that we're all attending. So, but I think the dinosaurs will move on, and there's new blood coming in, and it's very positive energy. And by the way, let me just say this. It's not that, and I never say this, it's not that I don't think medications are important. I think they are. I mean, I'm an infectious disease doctor. Where would we be without antibiotics? Think about it. I started in the field of infectious diseases because when I was a medical student in the late 80s, early 90s, it was the height of the HIV epidemic. And where I went to medical school in Newark, New Jersey, we had 2 wards of AIDS patients. And at that time, we had no treatment. We could just treat their opportunistic infections, but we didn't have anything to combat the virus. And you think about, in the span of my career, we've gone from a death sentence with HIV positivity to a disease now that is primarily a chronic disease, and we can treat it with the medications that obviously the goal here is to cure or to prevent, but for those living with HIV positive, that are HIV positive, we can treat it, which is amazing. And there are a lot of medications that play an important role, but whenever we can, we want to try to reduce dependency on medications. And if at all possible, we want to prevent the event from occurring at all, right? Primary prevention should be our goal. And that's another disappointment in medical school. When I was in medical school, I took a preventive medicine class. But you know what it was all about? It was about make sure you get your mammogram, make sure you get your colonoscopy, make sure you get your PSA. That's not primary prevention. That's early detection. So many doctors use that as prevention. Colonoscopy is not a preventive study. I mean, it's early detection. Primary prevention is not ever developing that polyp that leads to the cancer, right? And the way we prevent that disease is by eating a fiber-rich plant-based diet and exercise, all the things we talk about in lifestyle medicine.
And that's the huge part. It's the way that it's been taught, which makes the doctors think in the mindset that they are. And I wonder, for some of these dinosaurs who haven't received their invitation to the party, or they've received their invitation to the party, but they put it in the garbage, I wonder how many of them have come in contact with the information, but have dismissed it and haven't even committed it to memory. Like, for example, Adam's doctors, I should say, will they remember that he said to them, I went plant-based for a year, that's why, and they both said to him, no, they dismissed it. But when they show up and they have their own health issue, and all of a sudden it's important to them on a different level, and then it happens to come at the right time, how many doctors are switching over then? And that's always something very interesting to me.
In my practice, I've mentioned this before, I had about 40 to 50 patients who were also doctors. And the way that they became my patient is because we had a patient in common. Like, we had a diabetic who had come to see me, and we were able to reverse their diabetic state. And then their endocrinologist calls me and says, what did you do? How's Mary's diabetes reversed? And then we would have a conversation about lifestyle medicine. And the key was to send them the literature. So I would say, give me your email address. I'm going to send you some literature. Because again, medicine and the way we're trained is always about, is there the science to support the assertion? And once we got over that hump, the next call I would receive would be, Dr. Stancic, I want to come see you. And I'm thinking, as a colleague, we'll have a cup of tea. No. I want to see you as a patient because I'm struggling with my weight, struggling with depression, and I need to see you. And that was something that I had never predicted when I started the practice, but it was truly rewarding because I knew when I supported that patient, every patient that I care for is a privilege and an honor, but when I have a patient who's also a doctor or a healthcare professional, get them healthy, all of a sudden I know that that's going to change the way he or she practices medicine, and it's going to affect every one of their patients. And then that's how you can affect 300 more people by just interacting with that one, which is huge. So keeping that in mind, when you wrote What's Missing from Medicine, 6 Lifestyle Changes to Overcome Chronic Illness, were you writing it for the person with chronic illness, or were you writing it for the doctor? Well, my publisher would say I was writing it for the person with chronic illness, and I would say I'm writing it for the doctor too. I would love to give every medical student day one, when they walk into their first class, give them a copy of the book that they carry in with them, because I know that they're not going to learn it in medical school, and at least not right now. Again, the messages that are in the book are very simple and very straightforward. It's not understanding the pathophysiology of the SARS-CoV-2 virus. I mean, that can get complicated. There's a lot of things in medicine that are very, very complicated. This is not. This is pretty straightforward. But I think, again, our mindset is the solution to a complicated problem must be complex. Sometimes that's true. In this scenario, this complex chronic disease epidemic that we have created, I call it the man-made epidemic in the book. I know people don't like that, but that's the truth, and I always speak the truth. It is a man-made epidemic, so it can be an undone man-made epidemic, but we need to implement these changes. We need to have serious conversations, honest conversations about what we're consuming, we're addicted to these phones, we're addicted to social media, and it affects our sleep, it takes time away from our family, community, right? Part of lifestyle medicine is our relationships. That's medicine. We know that. We know people who have more connections and who are social live longer. There's a reason for that. I talk about that in the book. I use the analogy of a wheel when I describe lifestyle medicine. The wheel has 6 spokes, and it's diet, exercise, stress, sleep, substance abuse issues, and then social connections. And the reason I use the wheel is because they're all interconnected. They all rely on one another. Some of us are really good at food, or some of us are really good at exercise. But when we address all of those parameters simultaneously, that's when we achieve what I call the sweet spot, when you gain the greatest benefit. So I think that's an important point to make. You can't be great with your diet, run 6 miles every day and then drink a bottle of wine every night. That doesn't work.
And a lot of people will say, oh, I run so that I can drink. I run so I can eat.
I know. I've had many patients who run marathons and then eat cheeseburgers and smoke a cigar, and then they have a heart attack when they're 50. And they wonder why. I'm telling you why. Stress does a lot of damage. So if you're eating well and you're running every day, but then you have this job that you work at 85 hours and you're miserable and you hate your boss and you hate everything about it, that is doing a lot of damage. So we have to look at every aspect of our lifestyles, not just our food. Because again, I see this all the time, Shoshana, where I have patients they come in, they're super strong, 6-pack abs, right? They look awesome. They're an accident waiting to happen, really, just a ticking time bomb.
Their insides don't match their outsides.
They don't. And we see this often. And so it's really about taking a moment to reflect and addressing all aspects of lifestyle and mindfulness. Some of these issues can be tough because most of my patients are in their 4th, 5th, 6th decade of life, and they've been doing what they've been doing for a very long time. We fall into these, behaviors, and it's very difficult to break them and to start anew. And so lifestyle medicine in that respect is a challenge because creating change can always be a challenge, particularly in the world in which we live, where everything in our environment is flowing against optimal lifestyle, right? I mean, you get into your car and you get on the road and you hit 13, 14 different fast food restaurants, or we have the ease of everything's on television. And so we end up being very sedentary, right? So the world that we live in creates an environment so that it's anti-lifestyle medicine, but we have to become very mindful and assure that we're practicing all of these parameters on a daily basis.
I love using the spokes of the wheel, and I think that not every person is going to have a balanced wheel. Like the spokes are not going to be exact, and I guess it would depend on the individual as far as which one to start with. Like, how do you decide which lifestyle change to make first? And I guess you would look at the wheel and its balance. Is that what happens?
Yeah, I think so. I mean, I think that's a good approach. I mean, in the book, what I describe when we first get past the introduction is really an assessment. So there's some questions that you need to ask yourself, and they may be tough questions, and you have to be honest to yourself. And I ask people to pick up, a little journal and just write down your answers when you start. And again, you have to be honest. Sometimes it's hard for us to share with someone else, but between yourself and your journal, write the truth. And when we do that, when we're honest with ourselves and we're mindful, we can begin to construct something that's appropriate. Now, it doesn't mean that you have to change everything overnight, because I have to tell you that people who go about it that way often fail. It's not about changing everything overnight or saying, oh, I'm bad. That's another thing that we do, which I hate. You have 2 good days, and then maybe you make a decision retrospectively, you wish you had done better. And then there's this like, I'm bad, or now that I've done this, I'm going to give up. No, listen, celebrate those mistakes. That's what I do. Whenever I make a mistake, I celebrate it, because it causes me to stop and realize, how did I get there? What led to my making that bad decision? And then I learn from it, so that next time when I'm in that same situation, remember what happened last time? When I have a solution to the problem. I'm going to be forward thinking, and I'm going to create a solution to the problem before it occurs. I think we need to be kinder to ourselves. We're so hard on ourselves. And, the things we tell our children to be kind and giving and generous to others, we need to do that for ourselves, right? And we need to place ourselves first as women who, particularly, we're always, this idea of being the maternal one and caring for everyone in our family. But the truth is that you really need to care for yourself first. Because when you do that, you're going to be your best self, and you're going to be able to care for everyone else in your family. So I think not being so hard on ourselves, being kinder, and forgiving ourselves when things don't go perfectly, I think those are important lessons too.
Absolutely. And looking at it as a percentage. So if you were only doing things 20% of how you wanted it to be 2 weeks ago, and now you're at 80%, we do need to really look at the positive. If somebody hasn't seen Code Blue yet, or wanted to pick up a copy of your book, What's Missing from Medicine, where can they find those two?
I think the best place to go to is probably my website. It's drstancic.com, and it's sort of the website splits up into the book and the film, but the film is found on Amazon, on Apple, Google Play, just about every platform. Vudu, Vimeo, you can find it there. drstancic.com will take you to both. Same thing with the book, Amazon, Barnes & Noble, just about most independent bookstores, you'll be able to find it. But the book came out in January, and I'm really proud of it, because I put about 18 months of my life into writing that book. I had no idea what writing a book is, but it's a lot of work. I have a wonderful publisher who really supported me through the process. But I think the book is just a very honest conversation between myself and the reader. That's all it was meant to be. It is backed by science, but it's not meant to be a scientific text. It's not meant to be heavy. It's meant to be a conversation that I would have with you in my office. And I hope that it serves whoever reads it, and to introduce some benefit into their life. And because, as I said, I think we can all reap these benefits and live life to our greatest potential and enjoy our families. And as I said, that last day, let it be that, you define the parameters of that last day. And I think that's really my hope for all of us.
If our listeners wanted to reach out to you on social, connect or follow, where would you like them to go?
Well, you can connect through my website, or, I'm on all the social platforms, Instagram, Facebook, Twitter. I'm not a huge social media person, but somebody will respond to you and get it to me.
Okay, we'll put links to all that in our show notes at planttrainers.com. Dr. Stancic, thank you so much for being with us on the Plant Trainers podcast. It's amazing that you went from being a doctor of infectious disease to now being one that is managing and dealing with infectious healing, and all the work that you're doing. We're so grateful for it. Thank you so much for being here. We really, really appreciate you.
Thank you so much. It was a great pleasure.
Thank you. Thank you all so much for listening to this edition of the Plant Trainers podcast. We want to make sure that you subscribe on iTunes, Google Play, iHeartRadio, Stitcher, or any other podcasting platform.
We really appreciate the feedback we receive from you every time we get a 5-star rating or review on iTunes from one of our fans. It really helps other people find us, just like you did.
Thanks so much to our patrons. To become a patron, visit us at patreon.com/PTP403. patreon.com/planttrainers. Even supporting us with $1 really makes a difference in the quality of the show.
And don't forget to connect with us on Instagram and Twitter. Our handle is @PlantTrainers. Like Plant Trainers on Facebook, join our newsletter, and check out our website at planttrainers.com for awesome recipes, a list of our services, and of course, our latest podcast.
We encourage you to email your questions to info@planttrainers.com so that we can help you improve your quality of life through nutrition and fitness.
So we hope we've inspired you today. Join us again next time and have a healthy day. Or is that too corny?
It's a little cheesy.